The Ministry of Health and Social Services, of course, in collaboration with the Ministry of Education, Innovation, Youth, Sport, Art and Culture, have been working very hard within the technical committee to ensure that we are ready to provide the human papillomavirus vaccine as planned. It has actually started from the 4th of August, and it will be running up to the 15th of August to girls 9 to 14 years old. So, we are working in partnership with our development partners such as WHO, UNICEF, ITEC, to roll out this very important campaign. We know that, for example, human papillomavirus is responsible for close to 90% of the cervical cancer we see in Namibia, and we know that Namibia definitely is not doing very well when it comes to cervical cancer. So, we are actually close to 3 times higher than the global incidence rate for cervical cancer. We are right now at 33 over 100,000 cases, so it's quite higher compared to 13.3 cases per 100,000 globally. So we're working very hard. We have over we have 412 teams currently in the regions across the country, really helping our operational team to provide this very important vaccine to girls 9 to 14 years old. So in across all the 2,172 schools are also participating. So we have various sites and very competent teams on the ground. Thank you.
Could you kindly tell us why is obtaining parental consent for the HPV vaccine considered essential, and how is the ministry addressing the concerns or hesitancy among the parents?
That's a very important question. Throughout all these months when we have been preparing for this campaign, we really made sure to really make sure that we do careful consideration of various factors, particularly those pertaining to informed consent and parental rights, very important, which we know that all these issues, all these factors, if they are not well addressed, they do have a profound impact on vaccine uptake and community accepting the vaccine, because it's a new vaccine that we are introducing to our regular childhood vaccination schedule. So it's important for us to have had a plan. We have a communication plan, and we have translated materials in all the vernacular languages in Namibia. So yes, we have engaged thoroughly, and we are still doing that. It's a very important question because it's a voluntary exercise. Parents can choose to not have their girls vaccinated, but what we are trying to do is really to educate them on the importance of the vaccine. As I have said, human papillomavirus, HPV, is responsible for close to 90% of cervical cancer. So there is an opt-out consent approach that gives parents the opportunity to be engaged, to be educated on the benefits, as I have said, and then also to decide really if they want their girls to be vaccinated. And it's really within the parents. But it's also a very good opportunity to balance individual rights with collective public health benefits. And I think our teams, especially those engaged or undertaking risk communications, they are well informed and well educated to articulate this to parents and to caretakers to make sure that they understand. When you look at, for example, the Child Care and Protection Act 3 of 2015, give provision for the consent. And I think for the girls who are from 14 years, they can give consent if they are voluntary, if they are well educated. But because we want to make sure that the parents and caretakers are involved in decision making, we would rather really want to ensure that they give consent and they give and they are provided with accurate information to allow girls to access this very important vaccine. So the schools are informed at different platforms. They have engaged parents and caretakers. The campaign is doing very well so far. And of course, there are some communities still with hesitancy to allow girls to be vaccinated. Mm-hmm. But really, it holds an immense potential, this vaccine, the HPV vaccine, to substantially reduce the burden of cervical cancer in Namibia. So that's a very important question that you ask, yes.
Since the vaccine has been available in the private sector since 2007, what have been the key challenges in ensuring broader access through public healthcare facilities?
Vaccines usually are not cheap. We've been trying to really source the necessary funding for us to procure the vaccine. And since we got the cabinet approval to do this in 2023, I believe, we were able to really secure enough funding to ensure that we are not just vaccinating this year, we are introducing the HPV vaccine to our routine immunization schedule so we can secure throughout the years this very important procurement for this vaccine. So it has been largely funding, but also we wanted to make sure that we do have the necessary documentation as well as the support from all our stakeholders to be able to roll out HPV vaccine across the country. So it's largely funding, but also we wanted to do a thorough planning, including communication as well as stakeholders' engagement to be able to secure long-term funding from domestic resources that we receive from government to do so, and not rely on any donors that would be able to receive support for them. So it's government supported, it has a very high political support as well as a high level management support in this effort. That's why you see that the teams on the ground are really making every effort for us to kickstart and ensure that as we move forward, this routine HPV vaccine is introduced in our immunization schedule.
Is the ministry working with the Ministry of Education to integrate HPV and cervical cancer education into the school curriculum or health programs, perhaps?
Collaboration is really important here, and when you, for example, look at our existing program with the Ministry of Education, Innovation, Youth, Sport, Art and Culture, you will see that we do have existing platforms and programs already in place, especially through the Integrated School Health Program, where we have health promotion activities. And it really serves a very strategic purpose to integrate HPV vaccine as part of sexual and reproductive health services, as well as sexual and reproductive health education in school, in communities, and every platform where we have opportunities to educate and to provide these services to young girls as part of an integrated and comprehensive program for all parties involved, including education, health, and all the others that are key stakeholders in this intervention.
Lastly, does the ministry see the HPV vaccine rollout as a starting point for broader sexual and reproductive health education in Namibia schools?
The HPV vaccine rollout provides a very strategic platform to strengthen, as I said, sexual and reproductive health services education. Yes. While the focus really is on cervical cancer prevention, the rollout opens space for discussing, for example, bodily autonomy, the health rights, the disease prevention in ways that is age appropriate and culturally sensitive. So the two ministries, together with all our partners, we are exploring ways to expand sexual and reproductive health services and education in a structured manner, but also in a respectful approach, while also finding ways to accommodate boys and girls outside the school structures, through community structures, through other NGO work that are collaborating with us in this area. Because we do not want to just focus on one single intervention, but more of an integrated approach, because when we look at girls and boys, they all have different needs, and we cannot just go with one specific approach, but also to be able to integrate services. That way we will be able to save resources, but also to provide concise and comprehensive information to girls and boys. It's very important that I think we, as all stakeholders, including the media, we hold hands to ensure that the campaign is successful, as well as our stakeholders, especially gatekeepers, mothers, parents, fathers, caregivers, are fully educated and are aware of the importance of this HPV vaccine in our country. It's the first time that Namibia in the public sector is providing that, and as I have said, we will continue to provide that at our health facilities as part of the routine immunization, childhood immunization in Namibia. It's very important that we do that. And if there are any questions or there are any misconceptions around this, we are ready to clarify and demystify any misconception around HPV vaccine, because we know the benefits of HPV vaccine, especially when it comes to addressing cervical cancer and preventing cervical cancer.